The summer holidays have started in Europe. People just want to get away from work and school and their worries. Can we learn to deal better with our injuries and traumas? And with that, welcome to the COVID-19 special. In Peru, a young woman tries to build a new life after losing her father with the help of a piano and a cat. In the Garden of Paradise, Chilean author Cristian Alarcón has written a novel on a possible future after the pandemic. But first, to Germany. Many people want to take to the air again, but airport chaos is keeping them grounded.
Summer break has begun for schools in the German capital, and passengers crowd the check-in counters of EasyJet, Lufthansa and Ryanair at Berlin's airport. Patience is needed at the security checkpoint. Before flying off on vacation, you have to do a lot of waiting.
They're low on staff from what I hear, and they seem unprepared. If after 2 years of not flying, a lot of people have been laid off or are looking for another job, then something like this is bound to happen.
Here in Berlin, it's normally 3 hours, but certainly I would be concerned if it was 5 hours.
The waiting times at Berlin-Brandenburg Airport are not the worst. At other German airports, such as Düsseldorf, it's not uncommon to have waiting times of up to 5 or 6 hours before the security check. And it's been like that for weeks. Julia Vollmann-Gerber of the German Aviation Association says that the chaos at many German airports is regrettable, but could hardly have been prevented.
The pandemic has posed major economic challenges to the industry. Unfortunately, staff had to be cut, and after 2 years of the pandemic, the demand for air travel has risen dramatically. And then governments lifted restrictions at very short notice, so there was no real planning when it came to the restart.
Aviation expert Özay Tarim sees things quite differently. The Verdi trade union secretary looks after employees of the private service companies that carry out security checks at Düsseldorf Airport. He says that in the past 2 years of the pandemic, the companies have simply fired many employees. And now there are too few workers.
The state, which is responsible for this task, has passed it on to private security companies. And they want to make money. They're not social welfare organizations. They save money by keeping staffing levels low. We have a major staff shortage, especially in passenger control. There are security checks which all passengers have to pass through. They've failed to hire staff, and this is what happens.
The German government now wants to bring in thousands of workers from abroad, who would fill in wherever there's a staff shortage. The problem is that anyone who works on the apron where aircraft are handled or at the security checkpoints must be screened. The official mandatory background check can take up to 10 weeks. And that's not all. Sven Bergerlin of the Verdi trade union warned months ago of chaos at the airports. Even filling staff shortages with foreign workers won't be able to stop it in time.
Foreign workers are not a solution for the security checks themselves, as workers need very extensive training to be deployed there. The employees from third countries won't be helping in those areas. By then, summer vacation will be over.
So, for the time being, airports are not likely to see any relief. And a German airport security employee tells us that the constant stress for the staff is having dramatic consequences. He wishes to remain anonymous.
You see all the crowds here in the halls. At some point, you need a break. We don't get any, neither from the federal police nor from our employer. The passengers are simply being pushed through, and there's no real guarantee of aviation security anymore.
Germany's biggest airline, Lufthansa, has cancelled about 3,000 flights this summer due to poor ground handling. British Airways has had to cancel 10,000. The repercussions of the failed airport personnel policy during the pandemic are now being felt across Europe.
Japan was one of the last countries to lift entry restrictions for tourists back in June 2022. For more than 2 years, the Japanese have had their country to themselves. COVID-19 infection numbers there are surprisingly low. Why is that? Phoebe Amoroso reports from Tokyo.
At first glance, Japan would seem to be a country that's quite vulnerable to COVID-19. It has one of the world's oldest populations, and its cities are densely populated, yet the country's COVID death toll remains astonishingly low.
Japan didn't implement any strict lockdowns. Legally, the government couldn't do that. Instead, it asked citizens to voluntarily change their behavior, and the majority complied. That was one of Japan's great strengths in its pandemic response.
Even prior to this pandemic, many people in Japan wore medical masks in public places. After COVID broke out, most Japanese adhered to the recommended hygiene rules, avoided large gatherings and socially distanced. And they willingly got COVID vaccines. Today, over 80% of Japan's population is fully vaccinated. Yet despite fairly low case numbers, COVID-19 stretched Japan's healthcare system to its limits. Even though Japan has the highest number of hospital beds per capita among OECD countries, there are few intensive care beds. The healthcare sector is largely privatised. Many small hospitals lack the staff and resources to deal with COVID-19 patients and just turned them away. State-run hospitals couldn't entirely compensate for this deficit, so many patients died alone at home. Even before the pandemic, Japan's hospitals were short-staffed. Despite the relatively low number of COVID patients, workers suffered from stress and burnout.
At the height of the pandemic, nurses working in the hospitals caught COVID or became close contacts, so they weren't able to work. This led to staff shortages in hospitals, so the remaining staff had to do more overtime and more night shifts.
Kenji Shibuya says the government's response to the pandemic was also hampered by outdated legislation.
The Japanese infectious disease law, which was set 120 years ago, was not necessarily updated properly. So there is disruption between public health and medical care in terms of implementing testing and tracking the patient through the medical care system, lack of integration information technologies. These became obvious.
The government has announced plans to create a Japanese agency similar to the US Centers for Disease Control and Prevention, with an aim to streamlining its bureaucracy. It also plans to revise legislation to ensure greater provision of hospital beds and more universal access to medical care. Keeping lifestyle diseases like obesity and diabetes in check remains a priority.
Of course, the access to testing, vaccines, drugs is important, but eventually it is about the people and equity and the fundamental health services that would be most important to be resilient against the next pandemic.
Here in Japan, pandemic fatigue has set in. Mobility data shows a steady rise in people ignoring government appeals to avoid large crowds. In future, relying on a compliant public might not be enough.
Do you have any questions about COVID-19? Our science correspondent Derek Williams has the answers based on the latest research and analysis. Send an email to covidproducer@dw.com. This week, viewer Mohammed Nasir Akram wanted to know, did other pandemics end through human intervention, or does each have to run its own course?
Every pandemic is different. While the measures that we employ to combat them have a wide range of impacts, depending, among other factors, on how a pathogen is transmitted and how infectious a particular disease is or how infectious it becomes. So comparing one pandemic to another is kind of apples and oranges. To illustrate what I mean, let's look at a couple of pandemics and how their course was affected by human intervention, starting with what's viewed as the most severe one in recent history, the 1918 flu pandemic. Back then, there were no vaccines to prevent infection with the disease and no medicines to treat it, so only mitigation measures like quarantines and masking and social distancing really played a role in prevention. Researchers think that they helped some, but they weren't applied universally, and the pandemic was a devastating one. It only subsided after about 3 years, and it killed at least 50 million people. Let's compare that to HIV/AIDS, a modern pandemic that's now been going on for decades. It's a very different disease from influenza, not only because of how it transmits, of course, but also because the pathogen that causes it persists in the body. So HIV can't be cured. It can only be managed. It took decades to develop and distribute medications for that. And even today, not everyone who needs treatment has access. There's still no vaccine against HIV. So prevention efforts focus on education and diagnosis. Those interventions have helped drive down the number of deaths and new infections in the last decade, but according to the WHO, around 1.5 million new infections with HIV still occur every year, and it still kills an estimated 680,000 people annually. To compare again, that's around the total number of deaths in Brazil, directly attributed to SARS-CoV-2 since the start of the COVID-19 pandemic. But here, human interventions have played a much bigger role than they did, for instance, during the 1918 flu pandemic. It's really impossible to say exactly how many lives have been saved by measures like lockdowns or masking. But there's no question that it's a huge number. On the other hand, researchers have taken a stab at estimating how many lives have been saved by vaccines so far. One recent study calculated they'd prevented at least 15 million deaths in 2021, which translates into many more over the course of the entire pandemic. So human interventions really do alter the course of pandemics in big, fundamental ways, even if they can't shut them down completely.
COVID-19 has claimed an especially large number of lives in Peru. Camila Suarez's family was also affected. During the pandemic, she took care of her family members, but now she needs help herself.
In February 2021, Camila Suarez's entire family came down with COVID-19. 10 people were sick and isolating in the same apartment. Camila had just turned 18 and had to tend to them all, especially the most vulnerable in the family. Fortunately, no one suffered complications except her father.
He was a strong man, but he just wasn't very careful in those first days. On the fourth or fifth day, he came down with a bad cough.
10 days into his illness, Pablo Suarez could no longer speak or get out of bed. A doctor gave them advice and Camila tended to him. But his lungs were failing and he badly needed intensive medical care.
Eventually, he ended up on a COVID isolation ward and got oxygen. But he didn't get the same kind of treatment he would have received in intensive care.
In the second coronavirus wave, Peru's healthcare system was overburdened. Camila says there were only 11 intensive care beds for COVID patients. The family couldn't afford upwards of $50,000 for a hospital stay. 3 days later, her father died in a regular hospital bed.
I was at least able to give him pain medication. And I told him, "Don't worry, I'll stay here and won't leave you alone." He just looked me in the eyes and was practically tearing up because he'd already resigned himself.
What happened to Pablo Suarez is not unusual in Peru, the country with the highest COVID infection fatality rate in the world. Dr. Cesar Monaico of Peru's National Center for Epidemiology says that's not only due to deficits in the healthcare system, such as a shortage of intensive care beds and oxygen.
Instead of one pandemic, we've actually had several here because we've had outbreaks of several different diseases, not just COVID, within the context of the enormous social inequality here.
Peru had its first registered COVID case in March 2020. Soon hospitals like the Villa El Salvador were overflowing. That's changed, also due to Peru's vaccination program. But COVID exposed the weaknesses in the country's healthcare system.
The hospital has definitely improved, but we still don't have enough ICU doctors. And we still don't have enough staff to attend the needs of our population.
Camila Suarez wishes that Peru had begun vaccinating sooner. Then her father might still be here. She's traumatized by her loss, has panic attacks, and had to interrupt her studies.
What I need is a psychiatrist, a psychologist, who can help me cope with my depression and anxiety. I feel like a lost little girl now that my father's gone.
Camila Suarez's life has been forever changed by the pandemic, but she's trying to find a way to put the pieces back together.
The pandemic affects us all, and with every new wave of infections, our hope that one day it could be over is shattered again. DW reporter Hang Xuan Li talks to psychologist Leah Dom about how to build physical and mental resilience in uncertain times.
Ms. Dom, thanks for joining us.
Thanks for having me.
We keep hoping that the pandemic is finally over, but then the next wave hits and we're worried about the new variants. And then there's also the war in Ukraine and the climate crisis. At a certain point, it gets too much. How do we keep it all together?
Resilience is a really popular topic right now. There's a lot of interest in it. And that's likely to do with the fact that so many people are stressed and are feeling all these various crises somehow. Whether it's a subtle unease or worry or anxiety. And making that better isn't easy. In psychology, we differentiate between individual and collective resilience. Individual is looking at what's helped you through difficult situations in the past, like exercise or seeing friends and family more often. Those are methods of individual resilience, while collective resilience is when we become more resilient as a society. For example, by having certain structures to live within that make us feel comfortable and secure.
Can you train resilience?
From a psychological standpoint, it helps when you know that there's something you can do. Like wearing a mask to protect yourself. Something that makes sense to you, that seems like a good idea. Or it can be about making decisions for yourself or with your family, about your surroundings and how you behave, regarding things like protective measures.
Since the pandemic, we've been observing others much more critically. Why aren't they wearing their masks properly? Why aren't they wearing one at all, even though it's mandatory? Why aren't they social distancing? But what is a healthy thought process to get through the pandemic without living under constant stress?
This is an uncertain situation. It's unclear how things will continue over the next few months, what things will be like by fall. And people react to this kind of uncertainty in very different ways. Some people immerse themselves in information and want to read everything about it. And then there's the other option, which we're seeing more often after 2 years of pandemic, that people get so tired of all the information that they don't really want to be well informed anymore. They'd rather just brush the topic aside. It's similar with climate change, and there can be conflict when people encounter each other who deal with a crisis in such different ways. And what could help, I think, might be to look at how to communicate effectively despite that.
If I'm suffering from this stress that we've been talking about, and I realise that I can't cope with it alone, what do I do?
There are basically two factors. The first is, how strong are the symptoms? How stressed out do you feel? Are there strong feelings of anxiety that you can't really come down from? And how long have they been there? If they've continued for several weeks or perhaps even months and your usual coping mechanisms aren't working, or you're under a high level of psychological stress, I recommend at least getting counselling. And I'd like to add that we can't solve everything with individual resilience methods. The problems we're facing are so great that something also needs to change politically. Mental health needs to be taken much more seriously.
Thank you.
A pleasure, thank you.
And now we travel to Argentina, where we visit Chilean writer Cristian Alarcón in his garden. It's his personal paradise, and the perfect place to write a first novel.
When COVID came to Argentina in March 2020, Cristian Alarcón had just finished work on his weekend cottage, an hour's drive from Buenos Aires. Eager to escape the lockdown in the city, he made this his home.
I needed a place where I didn't feel so confined. There are 2,000 square meters of land here, plenty of space for growing fruit and vegetables, which I'd never done before. The garden enabled me to experiment and, in the process, discover how nature's clock works. Your mind and body adapt to these circadian rhythms, which are connected to the natural day and night cycle, beginning with sunrise and ending with sunset. Adapt to how the day breathes.
With some help from Antonio, a Paraguayan gardener, the writer and journalist set about creating his own Garden of Eden. He also began writing his first work of fiction, The Third Paradise. The book ended up winning this year's Alfaguara Novel Prize, one of the leading awards in the Spanish-language literary world.
The pandemic just naturally flowed into the novel. It wasn't a subject I'd intended to write about. The novel begins with the idea of creating a garden, a paradise, a fenced-in and protected territory, while I'm delving into the memory of my own family clan in southern Chile. So while the pandemic is present in my novel, it's not as much a theme in itself as a way of imagining the future.
Alarcón presented his new book at an event marking the 10th anniversary of Amphibia, an online magazine he himself founded. Argentine actor Joaquin Foriel read excerpts from The Third Paradise.
To imagine a garden is to submit yourself to a new consciousness. The steps I will take will be determined by the land, air, light, water, and time.
The event turned into one big party, even though Argentina was going through a fourth COVID wave at the time, though cases have now started to fall. Still, the pandemic has left its mark, not only on daily life, but on people's psyche too.
The pandemic brings us closer to the idea of mortality and makes us more existential. It confronts us with the message, you can die. Tomorrow might be your last day. So our actions are no longer so innocent. Suddenly, we become aware that we're only passing through this world. And then we're sometimes more careful, sometimes more intense.
On weekdays, Alarcón leaves his little paradise on Earth and drives to the university in nearby La Plata. Here he teaches students how to write a novel, using his own book as an example.
Here we have a scene set in 1970. So given that concept, what's the opening scene? The pandemic taught us the transient nature of relationships, but we're also willing to make new connections which nurture us. That has an impact on society and how we live.
And that's all for this week. Next time we'll find out more about booster shots and how to avoid catching COVID-19 in the future. See you then.